All right, it is about that time. So good afternoon and welcome to today's training, Facilitating Shared Decision-Making with Youth and Their Family Members, presented by the Nevada Center for Excellence in Disabilities, or NCED, and hosted by the Nevada Primary Care Association. My name is Alicia Torres. I am with the Nevada Primary Care Association, and I am joined by my colleague and co-host, Brandy Johns, for today's presentation. A bit about Nevada Primary Care Association. We collaborate with community health centers who provide exceptional medical, reproductive health, dental, and behavioral health care services to Nevadans by advocating for policy changes, providing training and technical assistance, and creating economies of scale through program management. For more information regarding our Primary Care Association or to subscribe to our newsletter, please visit us at nvpca.org. I just wanted to take a moment to thank the NCED for helping us with this training, for coordinating, collaborating, and for presenting, sharing your knowledge with us and our audience today. Before we get started, I want to just go over some logistics and housekeeping items for today's training. Please type your name and organization into the chat box. It is nice to see who in our community is attending the training today. You will have an opportunity to submit questions to the presenter by typing them into the chat box at any time. And during the presentation, please mute your phone or computer so we do not have get any feedback or background noise. And if you are on your phone and you have to put us on hold, try to mute. Don't put us on hold, please, because we will hear your hold music. Okay, at the end of today's session, you will be directed to a quick evaluation. Please take 2 minutes or less to complete this information. It does help us better serve you all and provide better trainings, quality trainings, and just lets us know what we're doing right as well. All right, and without further ado, I will turn it over to Lex Owen, who will get us started.
Great. Thank you, Lucia. Appreciate the warm welcome. I'm going to share my screen here. We're really happy to be with you here today. Stacy and I will introduce ourselves in a minute. But first, I just wanted to say, to reiterate that we are from the Nevada Center for Excellence in Disabilities. We are part of a specific project within the larger NCED, as we call it, which is the Family Navigation Center. The Family Navigation Network is the Family to Family Health Information Center for the state of Nevada. So we have both state funding from our Title V partners, as well as some HRSA funding. So what we aim to do really is, improve outcomes for families of children and youth with special healthcare needs or disabilities and their families, both related to accessing healthcare and satisfaction of healthcare. And one of the primary ways that we do that is through trying to facilitate family professional partnerships. And so we see shared decision-making as an aspect of that family professional partnership work. So we're really excited to offer this here. We're hoping also that this is really a discussion amongst us all, an opportunity to learn from one another as we move forward today. So if at any time, Stacy and I are really open to questions or comments or ideas throughout the conversation. So, we encourage you to put your question in the chat or feel free to speak up as we move forward. So we'll keep going. Okay, so today I just wanted to go over the learning objectives really fast. So here, again, we're going to share some dimensions on the construct of shared decision making, really focusing on the triadic nature of treatment planning, specifically, when we have youth involved, right? It's tempting just to see, again, even in that phrasing of family professional partnerships, sometimes we collapse that family unit into one perspective, but we know that there are multiple perspectives going on within that family. So really trying to kind of unpack that a little bit, thinking about how guardianship operates, especially when we have youth with disabilities, and young adults with disabilities even. We may have some guardianship things going on, thinking about how that actually operates. And then we want to think about, how do we integrate these kind of concepts with, best practices. What are the models out there? We're going to focus on one in particular that could potentially be useful. And then we get to the fun stuff. Then we get to talk through some cases and figure out how does this actually work in practice, and what can we do in our work together. So Stacy's going to go over our agenda for us.
So thank you, Lex. So for our agenda today will be, first, it will be introductions and welcoming, and then we'll go over what the shared decision making is. So you guys will know more about shared decision making and why it is important for youth with disability and their families. And we'll go over my experience with shared decision making, and we'll have cases to cover for cases that we'll show, and then we'll end with just a short survey and the post-workshop survey.
Awesome. And Stacey, do you want to just quickly introduce yourself?
Yeah, I'll go over. So I'm Stacey Azaribe, and I graduated with my master's in social work from the University of Nevada, Reno in 2019. I'm currently a licensed master of social worker. I just passed my licensure. I live in Reno, Nevada, and I'm glad to be here presenting on shared decision making with you guys.
Great. And I'm Lex Owen. So I wear a couple of different hats. The first is that I do co-direct the Family Navigation Network, that project of the Nevada Center for Excellence in Disabilities. I also work in the School of Social Work at the University of Nevada, Reno, as an assistant professor there. So I both Stacy and I have a lot of experience with the disability community, a lot of kind of advocacy and support work. We're both interested in kind of, again, how healthcare and the experiences of people with disabilities and their families intersect, and how can we improve those experiences. So just kind of, again, thinking about big picture, this idea of what is shared decision making. It's these kind of, words that we're putting together that seem ambiguous, but really what this is a construct of making sure that patients and their families are kind of a part of that medical decision making. And, this really emerges from history of folks not being involved in their own medical decisions, and really seeing the need to change that. And so here we're really thinking about collaboration, and understanding that collaboration can look really different, right? Depending on the patient, depending on their family members, and depending on the provider, right? And so this is customizable, right? This construct and this process, and there's several different kind of models, right, that you may be familiar with. So there's more than one way, right, to do shared decision making. So one of the things that is interesting about, we're kind of going down a narrower pathway, really, by invoking this idea of youth and youth with disabilities and their families, because there's been a lot of shared decision making as a construct that has come out of adult care, and so it's been less applied in pediatric settings and kind of family practice and health center settings, but it's also something that's emerging as a need, right, for to fulfill these kind of components of patient-centered care. And so one of the things that's been thrown around is, when we think about youth with disabilities, the idea of collaborative decision-making has been suggested as an alternative to this construct of shared decision-making. So just I say that just to kind of say this is a very nuanced and still emerging conversation, right? In terms of kind of both the research that's being done, the clinical, observation data that's coming out, there's still a lot to learn, but it's also really exciting because I think, invoking, as Stacy will kind of help us help reinforce later on, shared decision making is really part of that broader, commitment to patient-centered care. So I wanted to give a few examples of what this has looked like in the past. So one of the ways that shared decision making can kind of be pulled into the clinic is using decision aids or similar tools. There are several of these out there. One of the things that the model that we'll focus on today is Douglas Opal's 4-step framework. And so I'll show that on a later slide here very soon. But really, the elements that are here, right? Some of the steps that could be called shared decision making, right, are things like, just providing information about different options, using things like decision trees, and also emphasizing, what are the downsides and, what are the upsides, right? The potential kind of roads that different medical decisions could lead down. Obviously, you all are doing this already on a daily basis, but really thinking about, again, maybe what you are already doing, right? And placing it in this broader construct could have some benefit in thinking about, how do we really prioritize the involvement, the engagement, and the voice of patients and their family members. And so, when we think specifically to this last bullet point here on the slide, thinking specifically at the level of children and youth, really there are even smaller kind of almost kernels of shared decision making that could be pulled into the clinic, right? So we think about things like turn taking, right? Setting these standards in our in the clinical encounters, thinking about confirming understanding, asking questions, giving space for questions. So something I've seen actually is, folks will, providers can send out some information later on and they can, follow up with their patients, via patient portal or other, method. All of these things are ways, that we can continue to think about how do we best engage children and youth so that they're able to be involved, right? Or collaborate in some way related to those decisions. And so on the screen here, we have Opal's 4-step framework. So step 1, right, we're asking about whether there is, a decision with more than one option, right? And so, obviously, if not, that's the choice, and you move out of this decision-making process. But if there is more than one option, medically reasonable option, you would move to step 2. So step 2 there, really we're asking about, is there kind of is there a considerable difference when it comes to that benefit or burden ratio there? And then there's two kinds of, from there, Opal talks about 2 different pathways. And so if there is kind of a, that strong, a difference in that ratio or burden between the 2 options, you would move to the physician guided shared decision making model. And so again, there's similar, step 3 and step 4 can look really different depending on whether it is physician guided or parent guided. So step 3 is asking about how preference sensitive are the options, right? And so maybe there are additional things related to lifestyle impact, right? That would really make a difference. And so here we get into, we need the family's input to make those calls. So we're looking, depending on, whether those, there's some preference sensitivity. If it's low or high, you would kind of go in different directions. And then step 4 is that shared decision-making continuum. And so you're able to, look at all of those, all the previous steps and say, like, where do we go from here? So again, thinking about, this customization aspect I'm trying to emphasize, and also the way that this is really setting up a framework for ultimately collaboration. Now, I want us to notice what's missing from this really nice infographic here. And that's the youth, right? The patient themselves. And so certainly there might be some instances in which the patient is, too young to really have kind of language-based input, right? There's certainly instances in which that's possible. There's also instances in which, we might have someone who is, not able to really speak or process some of these questions, right? But even in those instances, right, where a person might have different communication or limited communication methods, we still have to think about where is that patient, where is that person in this process. And that's something I want us to continue to think through as we continue on here. Okay, so when we think about, why is this concept of shared decision making important? Why are we here, right? Why did we do this whole thing on shared decision making? Well, first of all, this is, fulfilling an ethical obligation, right? We are in emphasis in providing information, in making sure that we are emphasizing risk benefits of potential, decision roads, right? We are trying to facilitate autonomy and informed consent. And so obviously, that's a win right there, right? So in the literature, shared decision making has been demonstrated to have some good outcomes. And so we have, like I said before, this is an emerging area, specifically in pediatrics, especially and specifically also in primary care. However, we've also seen good outcomes for youth when it comes to increased understanding of what's going on medically for them and self-confidence. We also see decreased fear around that medical decision making. In families, we see higher satisfaction with that healthcare experience, and also less decisional regret, right? Because I think that's something that providers may have a fear of, right? That if we involve families too much, if we kind of have them being centered in that decision, they may regret that experience and then come back to us, right? So we don't want that. So if we see a decrease in decisional regret, that's a good sign. I will say, and again, in things like larger reviews of the existing literature, the effects have been weaker, but at the same time, given that this fulfills an ethical obligation and also really fits into the kind of, perspective of patient-centered care, it makes sense that this is something that we'd want to prioritize in practice. And I'm going to hand it over to Stacy now.
Okay, so I wanted to highlight the importance of shared decision-making when working with youth with disabilities and their family members. People should be the center of their decision making, and this is especially true for people with disabilities because their voices do matter in their decision making. And if they lack decision making skills, like Lex went over, if they lack decision making skills or they're too young to talk to their healthcare professionals about their decisions, they should still be included, and the plan should still be made by talking to either the family members or other third-party members. So that's highly important to in a way. You can go to the next slide. Next. Okay. And over here, it highlights the pros and cons of shared decision making and its impact on patient. Some of the pros will be with shared decision making. You feel like you have a voice, like I just stated. You feel like you have a voice of being seen. You're heard and you're seen, and you feel good about that. You understand what's happening because you're a part of it in some way with your shared decision making. And you feel empowered, as the person should be empowered to make their own decision making if they're able to or not. And then some of the cons of shared decision making will be if you're not in it, you feel invisible. You're not included in your plan to make it. And then you may not trust the decision as much because you weren't included in that. You don't know what's going on. You can move the slide, please. Okay. And then on this slide, I'm going to talk to you guys about my experience in my own shared decision making. So my experience was a good one. And I'm glad that my parents involved me in my shared decision making plan. With most children, they may not have that opportunity to participate in their own decision making plan. So I'm fortunate that I had that good experience. But the only part that I did not like, I would say, would be when the doctors, like other healthcare professionals, would not make direct eye contact with me, not look at me, and they were talking about me. So why not pay attention to me? And this made me feel like in the last slide that I talked about, made me feel invisible, not human enough, and like they just didn't care about my opinion. So okay, you can and I'll pass it back to Dex for the next slide.
Great, thanks, Stacey. So kind of building off of what Stacey was saying, we wanted to kind of emphasize the importance of triadic shared decision making when it comes to, engaging youth with disabilities and without disabilities and their families in primary care decision making. So here, of course, we see, at the center, we have the triangle of medical decisions. And really, this is obviously, a simplistic representation of this, right? We could have a lot of different, arrows and directions trying to kind of, attend to some of the dynamics, right, at play here. And so, but really just to kind of get a foundation here of what we're talking about, right? We're talking about including the youth with disabilities or a disability in that shared decision making, and acknowledging that their experience, their viewpoint, and their decision might be different from their parents, right? And it's this tension that we kind of want to address, anticipating that, it's easier for us to say, like, yes, do this, right? include the youth, right? But we know that this is in practice, this is far from simple, right? We have issues around, kind of a paternal approach, right? For good reason, right? Parents care for their children. They want the best outcomes, and they are used to running the show, right? Most of the time when it comes to their child's or youth's healthcare. And so, some of the things that we talked about previously, these kinds of kernels of shared decision making that can be inserted, right, without adding time to a visit, right, without having to change the code, right. Instead, you're able to kind of just instill these really small things in practice that may actually change how youth experience those conversations, and it may also change how the parent experiences those conversations, right? So for the first time, they may be asked to, let their youth speak, right? So that they can get a sense of, what that youth's input into their own decision, the own healthcare decision is about. And so, obviously the other thing that I think this, again, just overly simplistic, image demonstrates is that the provider is also an equal part of this, right? This is not about necessarily ceding, knowledge or control or authority, but rather, really broadening that conversation, And again, in a lot of ways, this falls into line with what you all are already doing, right, in practice. And I'm looking forward when we get to discuss the cases to hear about how you all have actually made use of shared decision making in the past, and how you kind of bring those kernels, as I call it, into your work. So just extending on some of the things, some of those tensions, right, that we were referring to previously. The in-between autonomy status can be a problem, right? It can be an issue when it comes to, for folks under 18, right? They don't have full authority. They don't have full, autonomy over making their healthcare decisions. And so, kind of, what we're suggesting, what Stacy and I are suggesting, is that in-between autonomy status should be granted something different, right? And with that, youth with disabilities who may communicate differently, who may process information differently, they still have a right to be a part of that collaboration. But we want to, acknowledge, of course, that is an issue. Guardianship. So, for folks, for young adults, over 18, but who still have, are under guardianship status, right? They, their guardians do have those legal rights to make decisions. However, there's no law against, if we think about this as assent, right? It's not full consent, but folks who have limited or non-autonomy statuses are still, given the opportunity to weigh in and be a part of that. So thinking about, how do we, really include, and maybe one of the things that you all are looking for is language in terms of how to have these conversations. And again, if that's the case, we can talk about that when we talk about the cases. But another thing that we want you all to consider is to think about how shared decision making can actually be also not only a part of the broader, kind of umbrella of patient-centered care, but thinking specifically about how shared decision making can also promote healthcare transition, right? So thinking about how do we help, pediatric or, providers or, youth who are seeing pediatric providers successfully transition to adult providers. And so, we know that the healthcare transition rates reported nationally by the National Children's Health Survey are pretty low, right? And so we know that this might be happening more informally. We don't always, we're not able always to capture the best data, but we know that we want to see that those numbers increase, right? And so, another thing that we can really relate to this, and this is something that Stacy talked about, was that, again, building those skills, right? If someone doesn't, Stacy talked about, if someone doesn't have those decision-making skills, well, on some level, right? Those skills are something that we can increase, that we can build, right? And so thinking about how do we actually, again, by having these little kernels in practice, right? How can we facilitate that self-determination? And again, self-determination is not about doing everything ourselves, right? But rather really having the ability to choose the direction that one's life goes in. And that's kind of a core component of disability rights and advocacy. And so we can bring that into healthcare settings in really small ways that might make a big difference. We kind of talked about this last point here, just a reminder that, again, thinking about, this broader, there's been a lot of debate about what's shared decision making, what's not. We're really, pushing for a really broad term that can, again, be kind of a a framework or a concept that you all can use as a tool, right, to customize and practice. So again, not that this is like an added thing to another thing that you have to add to your day, but rather to think about maybe what you're already doing in this framework, and to think about how you could even maybe do, push it a little bit more, or think about, are there times in which, you maybe wished you had done more of this or less, right? Just reflecting kind of on your own practice for what's ahead. Okay, so we are going to move into, let me pause and see if there are any questions, comments, things folks wanted to add. We are going to move into watching 2 short video cases, and then we will discuss these. Any ideas or questions that folks have? Great. Okay, so hearing none, I will turn the video on. Each of the videos are a little over 2-ish, I guess it's like about 2 minutes. So we'll view both videos, and let me also show you the questions at the end here. Whoops, let me see, I went to do that. So the things that I'd like us to think through as you're watching the videos, as you're listening to the cases, thinking about, going back to that Opal's 4-step framework, which I'll show you again in a minute. How would you, what else would you need to know? What further information would you need to have in order to apply this 4-step framework to these 2 cases? So the first case is actually with a little bit of a younger child, but we can imagine, right, that this could happen, at any point, right, during childhood or adolescence. So a child is diagnosed with type 1 diabetes, and so the options, the healthcare decision making is really around insulin options. The second is an older youth who's considering Crohn's disease treatment options. And again, also thinking about what challenges you'd anticipate, and then thinking about, what are potential ways that you could meet those challenges. And then finally, I'm interested in kind of just hearing about, as you view these videos and kind of think to what we talked about here today, what part of shared decision making do you most resonate with as a provider? Or maybe there's no part, right? Maybe you are, kind of being skeptical of this. So either way, if there's something that that kind of stands out to you there, I'm interested in hearing about that. So let's watch the videos first, and then we will go to our discussion.
So I'm Dr. Margaret Lawson, and I'm a pediatric endocrinologist here at CHEO. My research is focusing on shared decision making, which is a new area of research in pediatrics aimed at increasing families' involvement in decisions about their children's health. In the past, doctors made all the decisions on behalf of their families, thinking that they had the medical expertise to know what was best for their families. We now know that families want to be more involved in decisions about their children's health. And there's very good medical research and evidence demonstrating this, and that families and health professionals need tools and training to help them increase the level of involvement and ensure that families make decisions that are right for them.
Chloe was 4, is a weekend heading into her first year of school, and she the week leading up, she was getting sick, and we didn't know what was going on, and so she, we pretty much, and we were getting ready to go camping as a family and heading out. And Thursday night, when things turned difficult, she was panting, she was doing all this stuff that I was like, okay, this is not right. So mother instinct, take her to the hospital, and they told me to sit down because Chloe was type 1 diabetic.
Our pilot program was in diabetes, so we're like near and dear to my heart. And so focusing on decision that children and youth and families of who have type 1 diabetes face, which is which way to receive insulin. Should they be taking insulin injections twice a day, 3 times a day, before every single meal and snack, or looking at not taking injections, instead using an insulin pump? And those are big decisions for families.
Just having these tools here have helped us just to get to that next step. So just feeling comfortable, and I think that would help anybody because it's helped us, and I could definitely see that it would definitely help other people.
I'm really proud of how CHIO has embraced this and made CHIO, given CHIO a leadership role in the international community in terms of pediatric decision making. And that's pretty exciting. I'm proud that I've been part of that from the beginning. There were some challenges initially because physicians and families weren't sure what to make of it. It was new to them. And as they became aware and understood what it was and how it really could improve the care that families received and the choices that they made, it's improved success and satisfaction for everybody. And I think it led to CHIO being more successful, more recognized, and families being more satisfied with the care that they're receiving.
Okay, so that's case one. So Chloe was diagnosed with juvenile type 1 diabetes, and the next case is a little different.
I'm happy we could speak before you leave for your senior year of college. How are you feeling, considering your recent diagnosis and surgery?
To be honest, I'm nervous how Crohn's might impact my school year. I have classes, marching band, even soccer. I'm going to be busy and I don't have time for inflammation.
Well, let's work on a plan to keep your symptoms under control. The more we communicate, the better the plan. Now, what do you know about treatment options?
I did research online and there are so many.
Yes, there are a lot. We could consider starting with an immunomodulator. It's a treatment that changes how active your immune system is, reducing inflammation in your digestive tract. Many are taken as a pill.
Any side effects?
That's a great question and something you should always ask. Common side effects include mild nausea, headaches, even canker sores. There are rare side effects, but we can review those together so you can identify them.
With my luck, I would get them. Any other options?
We could also look into biologic therapies. They're proteins that block molecules that cause inflammation. They tend to have fewer side effects than immunomodulators and are taken as injections or intravenously. I want you to feel comfortable with your treatment plan. We can set up a follow-up call once you've had a chance to consider further.
Thanks, Doc. I feel good about my options.
Great. All right. So we're going to do this a little differently. So we're going to use something called a Padlet. And that is basically just a collaborative bulletin board where we can post different things. So I'm going to post in the chat. I am putting a link to the Padlet. You should be able to access that pretty easily. And then I'll also put it on the screen. So if you're in the car, on the go, and can't get to the Padlet, you are welcome to add your input via, you can just shout it out and I can put it in the Padlet to record it. So let's go there now. Can you all see the screen? Okay. So I've put the discussion questions here and then the 4-step, Opal's 4-step shared decision-making framework, which again, obviously we can, talk about the issues with this, but it's also really helpful to think about, how does this operate, right? In terms of making this call when we, it gives us conditions under which we would need to use shared decision-making, and then it kind of gives us a path. Depending, we don't have the specifics here, but it kind of gives us that process. So let me X that out. So to add new things to the Padlet, you just click on the plus sign and then add the post like that. So I would love, so take a minute and think about, again, the first case of Chloe and her type 1 diabetes diagnosis, and then the second person that I don't think we have a name for. So let's call her Marissa. So Marissa and her Crohn's disease. So thinking about, what else, thinking about that question one, what else would you need to know in order to apply this 4-step framework? What is the information we don't yet have, but that you would need in order to use that framework? I see a couple of folks typing, which is great. You're also welcome to add things in the chat if you don't want to mess with the Padlet, or you can just shout things out, and I am happy to add them here. And you can also answer the other 2 questions, right? So thinking about, what kinds of challenges. Yeah, so case number 1, the youth's input, we didn't hear from her at all, right? Yeah. And again, this speaks to this kind of, it's easy to do, right? But this idea that the family and the patient, right, sometimes get collapsed into kind of, the assumption that they have the same kind of viewpoint, right? And that may not always be the case. And while everyone is adding and thinking and typing, I'll also have Marcia O'Malley, one of our family navigator staff, who's joined us, who reminded me that we should share the supported decision-making website. And so supported decision-making is different than shared decision-making. But this is basically an alternative to legal guardianship. And so Marcia's going to share that website in the chat. Nevada is one of a few states, only a few states, that actually has legislation around supported decision-making. And so supported decision-making is essentially, again, kind of related to shared decision-making, but it's not limited to the healthcare setting. But really what it is, it's kind of a customized support approach. So the idea is that someone might need, substantial support 1 year of their lives, thinking about, adults with intellectual or developmental disabilities. But then in the next year, they may not need as much support, right? And so maybe guardianship isn't really needed. So that is something that I wanted to make sure. You may get families asking about guardianship, families of children and youth with disabilities. And so this might be something that you'd want to share with them as well. Self-advocates with disabilities have been in some ways, critical of guardianship because of the way that it does take away that autonomy, right? Autonomy status in both financial and healthcare decision-making realms. Okay, so we're getting some great comments here. So I'm going to read them out just for clarity's sake here. So again, thinking about case number 1, agree the next input that I see is agree on youth's input, learning more about their lifestyle, right, would be important, right? So thinking about, how does this, what's going to be the best thing? What's this youth's daily life look like, and how might it impact, how might insulin methods, right, impact that? Case number 1, again, we have another contribution, important to gather the youth perspective to be able to properly support an individual. Yep, for sure. Yeah, so in that first video, right, it was a kind of a good example of not including that. And then case number 1, right, we get into this knowledge question. What does the youth already know about type 1, right? Maybe we're starting from scratch. We need to explain, might need resources on, explaining diabetes to kids, right? What does that look like? And then case number 1, another great question is, does she have any fears about her diagnosis, right? So hitting on those things related to that are actually, that's how we measure, right, outcomes of shared decision making. So those are great connections. Any other things at all? So thinking about case number 1, let's stay on case number 1 for a minute. Going to this framework, right? I'm going to pull it up just for a second so we can all see it. a little bit bigger. So in the case of insulin options, right, we have a pretty good sense of there's not necessarily a medical benefit burden ratio difference, or correct me if I'm wrong, since I'm not a provider. But my understanding is that there's not really a difference in the medical, but that's why I think that question about lifestyle is the big thing, because that's actually going to be the biggest thing the biggest factor, right, that may impact adherence. And so thinking about, again, the youth's lifestyle, right, might be actually a bigger, there might even be things that the parent doesn't know about the way that child behaves at school, right? So we might even have to bring in some, a teacher or a person at school, right, who could give us some insight, or I'll obviously, right, ask the youth themselves. Let's see, I still, keep your responses coming. It's okay if they are not on with what I'm kind of following up on, but I'm also interested in thinking about, case number 1, I'm going to read this out here since we have a new contribution here. So anticipated challenge is a youth not feeling ownership of her care, not feeling empowered to care for herself as she ages. And so you would address the youth directly and involve her in discussions, right? So that kind of the sum, right, of these interactions that might make someone feel, alienated or disempowered related to their own healthcare. Those kind of things add up, right? So we don't want to get to, when they're 18 or 21 or whenever they're transitioning and they don't have those skills, right? We saw that modeled pretty well. We saw those skills modeled pretty well in the second video, right? Where she's what did I say? Her name is Marissa, right? Marissa and her Crohn's disease, right? So she's asking questions about, what's this going to be like? What are my options here? But also kind of just thinking that through. And in some ways, right, that's age appropriate. That's age. There might be a difference there. Yeah. And then, so any other case number 1 or case number 2 comments? Is there anything else that you would need to know for case number 2 for the Crohn's disease one that you don't have, missing information that you would need in order to implement shared decision making? And then I'd also love to hear your ideas about number 3, right? What part of shared decision making do you most resonate with as a provider? What part seems the easiest? What part seems the hardest? Are you already doing this? Or, are there lessons that you've learned from your own experience? I'll give us a minute. So for case number 2, we have a comment here. I didn't get the sense that the guardians were in the room discussing with the provider. Marissa seemed older. If so, it might be good to know the guardian's point of view. Yeah, that's true, right? So, and this is interesting, right? Because it kind of gets at both shared decision making and also healthcare transition, right? So she is in that transition in terms of going off to college, so she does seem older. But and then a similar response to the left here says, depending on her age and state law, we might need to consider family input, any other available treatment options. Yeah. So, one thing that didn't really come up in the Crohn's video was cost, right? So when the provider is talking about biologics, right? To me, my mind goes straight to price tags, right? And thinking about, obviously we want to get folks the best care, right? But thinking about that might be a conversation, especially if Marissa is still on her parents' insurance, right? That may be a conversation where you'd want to have the folks who are carrying that insurance in the room. That's right. Yeah.
Hi, Lex. This is Hannah.
Hi.
Hi. I just wanted to say something quickly in regards to number 2 for the discussion questions. What challenges do you anticipate? We have a good friend of ours whose kiddo, I think recently got diagnosed with cerebral palsy, and it's kind of hard to talk to the friend to let her know that, maybe it might be good to talk to your daughter about it. She is, I believe, she's of age now to where, she's able to understand what's going on with her body and what's going to happen and what needs to happen. But she's kind of keeping her in the dark. And so it's this whole discussion definitely resonates in my personal life right now with a good friend of ours, and just kind of being cognizant of, I don't know how this kiddo is now going to have to deal with things if she's not even aware of what's going on because she's being kept in the dark by her own parents. So just wanted to say that out there.
Yeah, thanks, Hannah. I mean, I think that's a great point, right? Like, it can be hard kind of as friends and as bystanders, right? To kind of see this and kind of know, like, professionally, this is like the best practice, but how do you intervene in that way? And that's a challenge for sure. Yeah. And we have additional input here for case number 2. So this person said, I liked how the provider was giving her, Marissa, the time to process the information and not pushing for a decision. Right. Yeah, I think that's also a great point, right? Thinking about maybe that time, maybe there's time between visits, right? Between follow-up that, the patient and their family are thinking about, the implications of that decision. Yeah. And in a lot of ways, right? I mean, this framework was originated out of, adult kind of more acute care settings and has moved to adult primary care and is now moving to children and adolescent primary care settings. And so thinking about how, time in both of these instances, right? They're somewhat time sensitive, right? But maybe not in the way that some of those other acute or more emergent issues are coming up. And so that's an advantage, right? Of some of these, the healthcare decisions that may come up in primary care settings. That third question, I'd love to hear if folks have any ideas in terms of, what are the components or aspects of shared decision making that really emerge with you or resonate with you the most as a provider. And so I'll say, I'm not a provider, but if I were, I feel like knowing how to present those decisions kind of equally, right? And maybe trying to eliminate some bias, right? If I had my own ideas about, what that patient and their family ought to do, right? I think that would be a challenge. Not, instilling my own kind of, again, not being a provider from the outside in. I'm wondering if that's a potential challenge to try to address, and if folks have had experiences addressing that aspect of giving those informational options. Conclude our discussion. I think, again, thinking about, how do we incorporate these components of shared decision making into practice in ways that are hopefully not onerous, right? But rather might actually, improve outcomes for youth, for families, might, allow, youth to kind of learn some of these decision-making skills in healthcare settings that could extend, across different components of life. So just wanted to show this one more time. And again, think, hopefully this is useful in terms of having this model that Opal has offered. It's gotten some pretty good outcomes when it's been used as an intervention in different studies. And I think also at the same time, like I've said before, there are ways that it could maybe be improved, right, or altered in order to make sure that we are including the child or youth in that concept, in this construct. So we have an ask, or Stacy has an ask. I'm going to let her talk about this for 1 second, and I'm going to go to the next screen.
Hi, thank you for letting me share with you guys about shared decision making. I have a survey that is for my program that I'm in Nevada land. The mission of it is it helps children and their family members to learn more about how to engage more effectively with children and their family members. And the survey that you guys are gonna take on this, it discusses why people with mental health issues are not receiving the proper services they need too. So if you guys don't mind in taking this survey, the survey is up there, but I also will show it in the chat. Okay, I see Lex already did it. So
Yes.
thank you. Yeah.
Great.
So yeah, if you guys don't mind.
Yeah, cool. And then I think that's it for us. So thank you so much. We really appreciate the time and your great involvement and contributions. We would love to, if you have questions or things that you want to talk through further, we'd be definitely open to that. So Stacy and I's contact info is here. And that's it for us. Are there questions? I think also there's a post training survey from, right, Brandy? Brandy will take care of.
Yeah, first I want to say thank you to Stacy and Lex. Thank you so much for joining us today and doing this presentation. And thank you everyone for attending. I wanted to let you know that we do have 2 other trainings with this series. We have supporting sexual and reproductive healthcare needs of youth with disabilities on April 18th. And we also have on May 16th, healthcare transitions for youth with disabilities. We'd love if you could join us again. Those registrations are on our MVPCA site, so we hope you can join us. And there will be a short survey following the session that'll pop up automatically. It is separate from what Stacy was talking about. Please make sure you check out hers as well. But if you could give us our feedback on the survey, we appreciate that. If you have any further questions, you can either stay on and ask, or you can contact me at bjohns, JOHNS, @nvpca.org. And on behalf of the Nevada Primary Care Association, we thank you for joining us today and have a great rest of your day.